Taking that very first step toward recovery, it's a huge deal. It's incredibly brave, but let's be honest, it can also feel completely overwhelming. And if you're feeling that way, please know that is totally normal. So what we're going to do here is walk through how to choose the right detox program for you so you can get the clarity and confidence you really need to move forward. And if you're watching this, I want you to hear me on this. You are not alone. This is such a personal journey, and finding the right kind of support, well, that's the foundation for everything. A healthier future isn't just some nice idea. It is absolutely 100% within your reach.
All right, so let's start right at the beginning. To make the best choice, we first have to be crystal clear on what we're even talking about. So, what exactly is detox?
At its very core, detox is really about giving your body a chance to heal. It's the process of flushing out those harmful substances, which allows your whole system to start rebalancing itself. We're talking brain chemistry, hormone levels, all of it. Just think of it like hitting a reset button, getting you ready for the real work of recovery ahead. Okay, so once you've decided to begin, you're faced with this really critical choice, one that's going to shape your entire experience. Let's break down the two main paths you can take. So the two main paths are pretty different. On one side, you've got what people call a standard detox. This usually relies on things like counseling and support groups, but, and this is key, there's no direct medical team watching over you. Then on the other side, you have medically supervised detox. This is a full-on clinical approach with 24/7 care, where doctors can use medication to make withdrawal symptoms safe and much more comfortable. And that is so crucial for more severe addictions. And listen, this is a point I just can't emphasize enough. Trying to detox by yourself or going to a program that doesn't have medical supervision can be incredibly dangerous. For some substances, withdrawal isn't just uncomfortable, it can literally be life-threatening. So here's the bottom line. For substances like alcohol, opioids, and benzodiazepines, things like Xanax or Valium, medical supervision is not optional, it is non-negotiable. Withdrawal from these can trigger really severe complications like seizures. A professional, medically guided detox is all about ensuring your safety first and foremost. So now that we get why medical supervision is so important, let's talk about what to actually look for. When you're looking at different programs, how do you know if it's a quality place? Let's run through a quick checklist. First things first, always check their accreditation and licensing. You want to look for names like the Joint Commission. That's basically your proof that they meet high national standards for care. Second, make sure they have qualified medical staff right there on site. Doctors, nurses, therapists. And finally, remember, your journey is unique. A good facility will never use a one-size-fits-all approach. They'll create a customized treatment plan built just for you. This is the question that stops so many people dead in their tracks. What if you're a parent? What if you have a job you can't leave? A student? The idea of putting your entire life on pause for inpatient treatment, it can just feel impossible. And that's a very real, very valid concern. But the good news is there is a solution. You don't always have to put your whole life on hold. Flexible outpatient care is an incredibly powerful alternative that's designed to fit recovery into your life, not stop it. So what does this kind of flexible care actually look like? Let's take a look at a specific example. There are programs out there designed to solve this exact problem, and one of the leaders in this space is the Center for Network Therapy, or as they're known, Recovery CNT. See, Recovery CNT was built on this very idea that life doesn't just stop for recovery. They offer effective, medically supervised outpatient detox all across New Jersey. This means you can get the help you need while still going to work, taking care of your family, and sleeping in your own bed at night. So, what makes their way of doing things different? Well, for starters, they focus on immediate relief from those agonizing withdrawal symptoms, often within the first hour you're there. Their care is super personalized and intimate. They call it boutique style, so you feel like a person, not just a number. This whole model lets you stay connected to your life, and because they treat addiction as a chronic illness, they help get rid of that stigma. Plus, they're in-network with most private insurance, which makes getting care so much more accessible. So you have the information, you know your options, and you know that help is out there that can actually fit into your life. Your new beginning, it can truly start right now. If you feel ready to take that next step, it's actually really simple. You can call for a completely private, completely confidential assessment. The number is 1-732-484-9661. Let me say that again, 1-732-484-9661. I promise you there is no judgment waiting on the other end of that line, just help.
You can also check out their website at recoverycnt.com. It's a fantastic resource to learn more, really understand all your options, and even see stories from people who've successfully walked the same path.
I just want to leave you with this one final thought. Recovery doesn't start with willpower alone. It starts with getting the right help in a safe and nurturing place. You absolutely deserve that support. Please, don't wait any longer to claim the healthier future that's waiting for you.